Your El Paso County Hospital District is asking the El Paso County Commissioners Court for support to address critical capacity constraints through a certificate of obligation. A certificate of obligation only requires a vote of the court versus a general obligation bond that requires voter approval. Certificates of obligation provide local governments the flexibility to finance projects quickly. In this case, the capacity constraints occurring at your hospital district existed several years ago, but we held off to focus on addressing the COVID-19 pandemic, which has only made the situation worse. No one wants to pay more taxes, and we understand. But what's important is that the El Paso County Hospital District belongs to each of us, the taxpayer. We will all, at some point, be recipients of healthcare. Your investment in the hospital district is working for you daily to ensure that when you, your child, or loved one requires the highest level of care, that we have the capacity to do so at a moment's notice. There are 5 urgent needs we are proposing to address through this bond request. For UMC, those include the addition of critical care beds, expanding our hospital and outpatient surgery capacity, and a neighborhood health clinic and urgent care center in central El Paso. For El Paso Children's, the need is for inpatient, surgery, and emergency department capacity. And the last item, which is a community capacity concern and need, is the building of a cancer center. On September 12th, the Commissioners Court will vote on the certificate of obligation. Our goal between now and then is to provide as much information to our community regarding this urgent request. There are 3 main reasons why these proposed projects are critical to the hospital district. First is for our patients and community. We want to ensure that we have the capacity to continue providing the health care that our entire community deserves. Second, Texas Tech is our community's healthcare pipeline, and UMC and El Paso Children's Hospital serve as their major training site. These projects are crucial in ensuring they can continue to grow their faculty and residents. And third, these projects are key to sustaining our financial model. Let's expand on that. When you look at this graph, the red line depicts our yearly cost for uncompensated care, or those that are uninsured. This is part of our mandate as a safety net facility. The green bar depicts property tax revenue used to offset the cost of uncompensated care, and the gray is the difference that we have to make up every year through other means. Our job is to create a mix of patients that are insured with those that are not in order to help close that gap. And we have done a good job of that. 10 to 15 years ago, UMC's patient mix was 50% funded and 50% uninsured. Today, due to adding services and specialists, more and more individuals choose to come to our facilities, which has allowed our patient mix to change to 72% funded and 28% unfunded for fiscal year 2022 thus far. The model requires an equilibrium. If we have less capacity and longer waits, the less likely paying customers will choose our hospital district for their care. That would put in jeopardy our ability to sustain this model and would require relying more on property taxes for support. The first project proposed looks to address our critical care capacity. UMC has 60 critical care beds to handle our intensive care patients, which are those who require the most care. For context, we recently had multiple days with more than 70 patients that needed to be in those 60 beds. Having a limited number of beds is not a recent challenge, but one that we faced prior to COVID-19. And despite the fact that COVID-19 hospitalizations are on the decline, the demand for beds continues to increase. To address this, we are proposing relocating 1 unit within the hospital to create 23 new ICU beds. If not addressed, 2 things occur. First, admitted patients get backlogged in the emergency department, which is the next safest place for these patients to be. Before COVID-19, it was not unusual for 30 or more admitted patients to be holding in our emergency department's 48 treatment rooms. That means that over half of our emergency department was holding patients who were waiting, sometimes over 4 hours, for a bed to become available. Second, scheduled cases are canceled and transfers from other hospitals are deferred. When we are at capacity, as we often are, we have to slow down those pipelines. This causes several problems. For example, those transfer patients typically require a higher level of care that they are not able to receive at other hospitals. In fact, 47% of our trauma cases are transferred from other hospitals. The lack of availability means those patients may not be able to be transferred to receive the care that they need. In addition, transferred patients or those that are referred typically have insurance. Therefore, if we reduce this volume, it negatively impacts the financial model discussed in the previous slide. The second set of projects addresses our immediate surgical capacity needs. As with our critical care capacity, we are currently challenged to serve the surgical needs of the community. The graph on the left depicts the number of off-peak minutes that we are conducting outpatient surgeries, which are typically the most stable and the lowest risk. When traumas occur or more severe patients are in need, those needing outpatient procedures are the first to be bumped. These cases, year over year, are increasingly being pushed to off-peak hours, which means into late evenings or on weekends. This is not ideal, and it is more expensive given we pay more overtime to our surgical and anesthesiology teams. It also lowers patient satisfaction. As you can imagine, if you are fasting and waiting to have your surgery, the longer you have to wait during the day, the less pleased you are. To address these issues, UMC will need an additional 9 operating rooms, 3 in the hospital by reconfiguring our current layout, and 6 in an ambulatory surgical center. Of those 3, 1 will be equipped with advanced imaging, otherwise known as a hybrid operating room. UMC is the only local hospital system in El Paso without this capability. The second operating room would be used for burn surgeries. Last year, 27 individuals were transported out of El Paso due to severe or major burns. This operating room would allow us to treat patients at home as opposed to having to send adults to Lubbock or children to Galveston for care. And that assumes those facilities have bed space available, which often they don't. The third operating room would be for surgical robotics, which helps provide minimally invasive surgeries. The use of robotics has had many benefits to include less pain for the patient, shorter hospital stays, less risk of infection, less blood loss, and shorter recovery. We are also proposing to add 6 operating rooms in an ambulatory surgical center. This is key for not only addressing outpatient cases as mentioned before, but also for Texas Tech. Many Texas Tech specialties, such as gynecology, orthopedics, and ear, nose, and throat, need access to an ambulatory surgical environment for training purposes. But it is also important for recruiting valuable faculty to grow these areas. Remember that Texas Tech does most of its surgical training in UMC operating rooms. The third project is to build a 35-bed central neighborhood health clinic. Modeled after our successful clinics on the west and east sides of El Paso, this clinic is needed for several reasons. The central El Paso and Mission Valley corridor have a more senior population. In fact, 18% of this area's residents are 65 or older. For that reason, although the clinic will provide care for all, it will have a focus on geriatric care. In addition, we are proposing placing a 15-bed urgent care center along with the clinic. This map shows the urgent care centers in central and east El Paso. As you can see, the corridor south of the freeway from Central to the Mission Valley is underserved by urgent care centers. Having one in this corridor helps address healthcare inequities and provides an alternate venue for non-emergency situations to be addressed. The fourth project deals with addressing capacity for our littlest patients and their families. El Paso Children's Hospital provides the highest level of pediatric care in West Texas and southern New Mexico. Since opening, they have been able to decrease children having to leave El Paso for pediatric subspecialty and surgical care by 85%. Data indicates that more and more babies are surviving premature births, many of whom suffer from multiple chronic conditions and who need specialized care. El Paso Children's Hospital has invested in meeting those needs. However, that has also led to increased demand. Projections indicate that by 2025, El Paso Children's Hospital will need an additional 22 beds and 26 more beds by 2030. The building's 8th floor is a shell and was left empty for future growth. By building out that floor for patient care, we were able to add 26 patient beds. In addition, El Paso Children's Emergency Department has 13 treatment rooms, but studies indicate that it should have 22 to 24 to meet current demand. The request here is to reconfigure their current emergency department and add 9 new treatment rooms and also include space for family members and clinical support staff. The final project is the construction of a comprehensive cancer center. UMC, El Paso Children's Hospital, and Texas Tech are ideally positioned to provide this much-needed care. Today, cancer is the second leading cause of death in the United States, with studies indicating that almost half of men and about 40% of women will be diagnosed with cancer at some point. El Paso is one of the largest metropolitan areas in the United States that does not have a comprehensive cancer center within a 2-hour drive. Yet, over 3,000 El Pasoans are diagnosed with cancer each year. Currently, no local cancer program provides the full spectrum of care in a coordinated single setting. This lack of care leaves many having to seek care elsewhere if they can afford it, adding yet another burden in the journey. This lack of these services also leaves a major gap in training for Texas Tech residents and its students. To execute these projects will also require the purchase of necessary medical equipment, addressing information technology needs, and purchasing certain properties within our area to relocate certain staff from the hospital. These purchases will also further shape the Medical Center of the Americas campus, which helps develop the international medical center that we all deserve. As taxpayers, you may want to know what the financial impact to me for a bond of $345.7 million will be. This slide illustrates that debt structure that splits the impact into two segments. The first 10 years include the cost associated with bricks and mortar and equipment, given equipment typically has an estimated useful life of up to 10 years. Following that, for years 11 through 25, the cost will strictly be associated with the bricks and mortar of the projects. Please note that these figures are based on the cost of a $100,000 home valuation. We use that number for ease of allowing you to multiply that depending on the value of your home. So for a $100,000 valuation, for the first 10 years, the annual cost would be roughly $57 or $4.73 a month. For the remaining 15 years, the annual amount will decrease. That annual cost would be roughly $29 a year or $2.39 monthly. As you know, interest rates have been rising. The Federal Reserve Board increased rates in mid-June, and it is anticipated that they will raise them again at the end of July, September, and possibly November of 2022. The longer we wait, the more expensive this request becomes. If the Commissioner's Court or other circumstances require that this request go to the voters as a general obligation bond versus a certificate of obligation, the earliest we could do that would be the May 2023 election. It typically takes 6 weeks to execute a bond pricing sale. Therefore, it would occur no sooner than July of 2023. Between now and then, it is estimated that this would be an increase of $62 million to the bond cost. Please know that your El Paso County Hospital District has worked hard to be good stewards of your tax dollars. This represents the property tax bill for a resident living within EPISD for 2021 and 2022. Tax rates for 2023 will be adopted by local taxing entities during August and September. You will see that between 2021 and 2022, UMC dropped its tax rate to 8.26%, or 25 cents of the dollar. Although we do not yet have the final property tax rolls from the Central Appraisal District for 2023, it is the hospital district's current intent to suggest passage of what is called a no new revenue tax rate, meaning it will keep the same revenue dollar despite increased property tax values. This also means that the tax rate for UMC will more than likely decrease yet again. A few additional notes on the hospital district's finances. In 2023, it is projected that the hospital district's budget will be nearly $1.2 billion. We are able to leverage the 8 cents from property taxes and provide over $1 billion worth of service to this community. This is a tremendous return on investment. And when you look at the total amount of property tax revenue as a percent of the hospital district's total budget, which is comprised of UMC, El Paso Children's Hospital, and El Paso Health, it only comprises 11% of the total tax revenue. Again, this shows you how your hospital district leverages its funding in the most prudent manner to provide significant, quality health care. And finally, if the certificates of obligation are approved, the property tax increase will not take effect until October 1 of 2023, given the 2023 budget and tax rate will have already been approved before the bond sale can take place. Remember that this is an investment in El Paso and for all in El Paso. This increase will not only provide added healthcare capacity for our community, it will increase higher paying jobs for El Pasoans. In fact, estimated at an additional 400 jobs, which will infuse an estimated $31 million into our local economy every year. In addition, these capacity initiatives will create approximately 850 construction jobs, not including the feeder businesses benefiting from this construction. This provides a one-time infusion of approximately $38.5 million into our local economy. To close, All projections indicate that these projects pay for themselves and help further the financial position and your investment in our El Paso County Hospital District. We thank you for your interest. Addressing these critical needs now ensures that we can continue to advance our ability to provide world-class care for all in our community. For additional information, please visit www.capacityforcare.com. And to share comments or questions, please email comments-questions@umcelpaso.org. Thank you.